I want to start with the nutrition aspect.
Sure.
So, what are the basics that you look to make sure that you're supporting your hair?
Yeah. And so let's just talk, real quick about how highly metabolic this cell population is. I mean, you're born with about 150,000 hair follicles on your scalp. They produce hair at about a quarter to a half inch a month. So what does that mean in terms of timing and amount of energy that your body dedicates to hair? Think about this. In the listening to an hour-long podcast, they've already grown 6 feet of hair on their head if their head of hair is healthy. And so there's a lot of metabolic commitment. And you mentioned that if you're caloric restricted, your body's going to shift towards more critical organ systems, and there's no question about that. So nutrients and fuel. As we said, the backbone is protein intake, and we know that protein is critical to maintain muscle mass, maintain your bones, to maintain your brain function, and all of the other functions in your body. But certainly, your hair is a barometer of the caloric intake. Once you start cutting that back severely, you're going to see it happen. And it didn't just start with Ozempic. We knew this was happening way before we had drugs for diets, so to speak, and
Right.
the skinny shot. So just as an example, I don't know if you remember, bariatric surgery went kind of through a
Mhm.
surge where people were getting stomach stapling and then the balloons and sleeves and so forth. And what was happening is you get a much smaller, stomach out of that, and you basically would get fuller faster, and you wouldn't be eating as much. And of course, these folks would lose hundreds of pounds potentially over the course of a year. But what they did notice is that there was a severe impact on their skin and their hair, and it's because these are highly metabolic mini organ systems that are responsive to the amount of fuel and nutrient intake and absorption also, by the way. So if you're not absorbing very well, that's also going to create some havoc in your hair follicle. So those are all really important things. And of course, we can talk about B vitamins and zinc and biotin and so forth. All of these things are very, very important when it comes to growing good hair, and even circulation. Because think about it, you've got the hair follicle, which needs a certain amount of building blocks. Then you need oxygen. Oxygen is carried by the blood circulation. If your circulation to the skin is poor, if you're a smoker, God forbid, I mean, you're cutting down on the blood supply. That sprinkler system to the garden, if you will, if you catch the analogy, is really becoming restricted. So in my practice, we have a variety of supplements that we would apply if we find that the person is, let's say, nutrient deficient. And this could fall into a category of, an undergraduate college student, let's say, who's, eating junk food and not sleeping well and all of that business. Let's get them some good protein supply. We have builder collagen. We can put a B complex, we call A list, which are the multivitamin that we use. We can supplement with a higher dose biotin if we need to. Those are just some of the very basic things. If they're dysregulated in terms of their microbiome of their gut and they have inflammation there, maybe we put them on a good probiotic, settle that all out. But the nutrients and fuel are really, really critical. So whether you have had bariatric surgery, you're going on Ozempic, or you're even on some caloric restrictive diet, or even if you're a vegan or vegetarian, you might have a hard time getting enough protein into the system. I'm not saying you're not getting enough protein into your stomach, but even just translating that into your body, it can be a problem for
Yeah,
sure.
I love that you said translating into your body because it's not just known, it's not just absolutely going to be happen that whatever you eat is going to translate and assimilate in your body. If your gut's not working, if you've got leaky gut, or if your liver's backed up, things just that there might be something in that wheel that is not letting it turn. The one thing I wanted to stress and emphasize is essential amino acids and collagen are needed. They're separate. Collagen is a protein, but collagen doesn't necessarily build your muscles. There's different jobs that they both do. Can you explain the role of essential amino acids and collagen and how they're both needed?
Yeah, well, the good thing about collagen, there's been some debate of whether these collagen molecules are actually absorbed in the way that they're provided, or do they break down into the amino acids, which are the building blocks of the collagen and other proteins in your body. And collagen proteins are certainly not all inclusive. There are some missing pieces of that puzzle. You're not getting every essential amino acid with just collagen supplementation. But we do know that there are certain manufactured and proprietary collagen formulas that have been shown in clinical trial work to improve joint health, for example, or skin health or hair. And so those are the very specific ingredients that I look for if I want to provide collagen to my patients, I want to know that this particular collagen or multi-collagen mixture has some science behind it. And so that's the only way we're going to either put our name on it, so to speak, or recommend something to our patients. But yeah, that's really important. And and today a lot of people are also talking about nutraceuticals, which are maybe fall into the category of ancient herbs, right? So things that are non-pharmaceutical that actually have a very strong or proven to have a strong biologic effect, whether it be ashwagandha for stress or curcumin turmeric for inflammation. These are all can be very important depending on your situation. And that's why if someone's having a hair loss issue, it takes a lot of time to kind
Mm.
of dissect through all of these things. And that's one of the things that we do in the practice here at Bauman Medical. Before we even put a camera on your scalp, we're going to talk to you a lot about what's been happening. Are you seeing excessive shedding? Has there been any kind of change in your diet? Have you had a recent surgery like general anesthesia exposure? Have you been jet lagged? Have you had a vaccination? Have you had COVID? These are all things that can dysregulate your immune system and other systems in your body that are critical to make your follicles do what they are born to do, which is to grow beautiful hair.
Right. And just all the things that you mentioned, they are stressors on the body. And what does the body do when it stresses out? It sends that energy to take care of whatever the stressor is and takes away the circulation and the energy to the hair follicles. And circulation, I notice when my thyroid is down, because my thyroid can go up and down. When my thyroid's down or my lymphatic drainage is down and circulation is down, I feel like my hair is limp and weak and dead compared to when all those things are running smoothly. So, do you see a lot of